Hello everybody, this is DMA like FMGE hacks, and today we are going to talk about the dermatology. So speaking about the dermatology, the very important one is your bacterial infection, and followed by the fungal infection, followed by pigmentation disorders, and miscellaneous contributes for 62%. So we classify the dermatology into three areas, like the same like in the ENT and ophthalmology. We talk about the disorders, we talk about the diagnosis, and we talk about the treatment plans. So I'd rather classify the dermatology into three sections. So one covers your dermatological disorders, and another one covers your diagnosis and treatment, and another one covers your plan of treatment. So speaking about the dermatological disorders, the very first one is your infections, where you see the bacterial, fungal, and viral infections on the skin, and sometimes the parasitic too. And apart from that, you have the inflammatory conditions like eczema, psoriasis, and the lichen planus. And apart from that, some neoplastic conditions like skin tumors like a melanoma, and other skin disorders that you have to remember. These falls under the category of dermatological disorders. And then we talk about diagnostic test and procedure. Speaking about the diagnostic test and procedure, the very important one is your wood lamp examination and their interpretation of results. So all the wood lamp examination and the results has been given in a wonderful table in the QRS. You have to remember that, and try reading it if you have a time. And just a small table where you shows the wood lamp examination and what type of pattern the condition may be shown on the wood lamp examination. So that was a given table in the QRS book, which was quite really nice. You have to remember, I recommend that. And apart from that, you have the biopsy indications and techniques and interpretation of your results, skin biopsy. And apart from that, you have a patch testing where you see the indication, technique, and interpretation of the results. So these are the areas where you focus on the diagnosis of your diagnosis in your dermatology. And then you have this therapeutic modalities. Speaking about the therapeutic modalities, you have this corticosteroids and the calcineurin inhibitors and retinoid in case of a topical one, and systemic ones such as antibiotics, antifungals, and immunomodulators. And phototherapy, what are the indications, types, and other complications. So speaking about the dermatology, people, dermatology is one of the low yield area where you may expect to see the few contents. So speaking of a dermatology, what are the areas you have to remember is you have to remember the anatomy of skin, nail disorders, and a few important diseases like lichen planus, pemphigus disorders or pemphigoid disorders, bullous disorders, bullous disorders, and psoriasis. These are the areas where you may get at least 3 questions out of 5 questions from dermatology, where remaining 2 would be somewhere like infection findings. For example, like infective endocarditis, you see the splinter hemorrhages, and there are some skin signs, infection findings, and skin signs, and other important areas where they may ask you or they may test you your dermatological knowledge. But this is the area where you may expect to see the dermatology questions, people. So very short subject, yet a high yield subject, and you can score good in that subject. Okay, anyways, thank you for watching, and we will come back with the new subject.